Constipation. Causes, symptoms, and treatment. Constipation refers to bowel movements that are infrequent or hard to pass the stool, as often hard and dry. Other symptoms may include abdominal pain, bloating, and feeling as if one has not completely passed the bowel movement. Complications from constipation may include hemorrhoids, anal fissure, or fecal impaction. The normal frequency of bowel movements in adults is between 3 per day and 3 per week. Babies often have 3 to 4 bowel movements per day, while young children typically have 2 to 3 per day. What is constipation? Constipation is not the same as constipation in children. As children grow, they normally learn to pass stool by themselves. Adults who have constipation usually have hard stools that are dry and sticky. This is often due to straining to pass stools, which leads to inflammation of the lower bowel, peritoneum. What are the causes of constipation? The most common causes of constipation in adults are obstructive processes in the gastrointestinal tract, infections, irritable bowel syndrome, biliary issues, dehydration, diabetes, lack of exercise, poor nutrition, mental stress, sleep disturbances. Takeaway: constipation is a common condition that affects around 20% of adults, and can cause some degree of functional impairment and even impair patient satisfaction. Constipation causes stress, change in diet, dehydration, and infections are all possible causes of constipation. Not getting enough fiber and too little fluid are often causes of constipation. How do I treat constipation? Tip: drink plenty of fluids to prevent dehydration. Drink plenty of fluids to prevent dehydration. Step 1. Drink plenty of water. Most people don't consume the recommended amount of fluids. Water consumption of at least 8 glasses per day is important. The goal is to drink more than you think you need. Drink a full glass of water when you wake up, then take a sip of it every 15 minutes throughout the day. Step 2. Maintain a healthy diet. Constipation symptoms: constipation can be the result of a number of different problems. People with constipation may have an inadequate intake of fluids and improper digestion and absorption of food, a laxative that does not work, the ability to tolerate too much solid food too quickly, blood in the stool, hemorrhoids, difficulty swallowing. Babies may cry when feeding in certain positions, redness or red streaks in the stool, bloating and abdominal pain, cramping in the abdomen, lack of appetite, a changing bowel movement pattern, the rectum may stick out of the body. Constipation and infant. To avoid constipation and alleviate symptoms of infant constipation, it is essential that mothers follow the standard rules for nutrition and health of babies. Constipation treatment: go easy on the fiber in foods. Good sources of fiber include whole grains, legumes, vegetables, fruit and soy products. Fiber is easily absorbed by the body. Less than 20% of people who are suffering from constipation get benefit from having less fiber in their diet. Use a slow-acting laxative or stool softener. These are medications that reduce the amount of stool moving through the body to provide relief from constipation. Try high-fiber foods such as vegetables, fruits and oatmeal, as well as frequent bowel movement schedules. See your doctor to ask about medication treatment for constipation and to check your medical history for other health conditions that could be causing constipation. How often should I go to the bathroom? Prevention: eat at least 2 servings of fiber-rich foods daily. Include fiber-rich foods in your diet like fruits, vegetables, whole grain breads and cereals. Soaking your fiber-rich foods and eating them slowly can help you get fiber all through your body. Allowing fiber to be absorbed by the digestive system can help reduce constipation. Water is also essential in the prevention of constipation. Water can help flush out the bowel and help improve constipation. Diagnosis: a doctor may ask questions such as how often the person has had bowel movements. The doctor may also take a blood or stool sample to check if there is any infection or inflammation that is the cause of the constipation. A doctor may also show signs of infection. Treatment may include some other issues or causing constipation. Conclusion: while constipation is a normal and common condition, it can lead to other health problems. It can affect the gastrointestinal tract and cause discomfort, dehydration, and painful bowel movements. Constipation should not be taken lightly. If a person suspects that he or she may have a bowel obstruction, they should see a doctor right away.